Staffing regulations for nursing homes. The Biden administration is proposing the first ever rules for nursing homes nationwide. Sonica Bargo joins us now with the details on how it could impact mid-state facilities. Sonica.
Dennis, these regulations would apply to nursing homes that participate in Medicare and Medicaid, and the rules are getting mixed reactions. Some advocates say these standards are needed, but industry leaders say the proposal is confusing and puts an unnecessary strain on an already struggling field.
This is another unfunded mandate.
New federal staffing minimums for nursing homes.
This is a federal mandate, a one-size-fits-all approach.
A bad idea, according to President of the Pennsylvania Healthcare Association, Zach Schamberg.
This is setting up providers across the state for failure in a state with one of the oldest populations in the country.
Schamberg says PHCA and other groups worked with former Governor Tom Wolf to establish state standards that work for Pennsylvania.
Why can't these discussions take place at the state level?
But the Biden administration argues overall standards are necessary to fill gaps exposed by the COVID-19 pandemic. Health and Human Services Secretary Javier Becerra said in a statement these standards, quote, will improve resident safety and promote high-quality care. Under the proposed rules, nursing homes would need a registered nurse on site 24/7, and staff would have to provide 3 hours of care per resident every day. Schamberg says that would create a mismatch between national and state rules.
We're going to have providers across the state who are not going to know which ratios, which standards, which overall PPD they meet.
And he argues the regulations don't address the struggle to hire more nurses.
With no workforce development initiatives.
The proposal does outline a plan to invest $75 million to make it easier for people to work in nursing homes. But Schamberg questions where the money comes from. He's concerned the burden will fall to the states and providers who might not be able to shoulder it.
We will see nursing homes take beds offline. We will see nursing homes discharge residents. And ultimately, as we've started to see throughout the pandemic, we will see nursing homes close their doors.
Now, it will be years before these regulations could take effect. The proposal now enters a public comment period. In the studio, Sonica Bargo. Alicia, back to you.
Sonica, thanks so much.